Far too many Canadians and Americans die each year from cancer. So most metastatic cancers remain incurable, but we are making progress as far as being able to prolong life expectancy, improve symptoms, and improve quality of life. In the videos included in this YouTube channel, I will be including many discussions on different aspects of the healthcare system in general and cancer in particular. My name is Dr. David Stewart. I'm a medical oncologist in Ottawa, Canada, and a professor of medicine at the University of Ottawa. And since I graduated from medical school in 1974, I have spent more than 38 years working in the Canadian healthcare system and 12 working in the American healthcare system at the University of Texas MD Anderson Cancer Center in Houston. I recently wrote a book on cancer called A Short Primer on Why Cancer Still Sucks. It is intended for patients and can be purchased online if you're interested through Amazon Books. I give a free electronic copy of the book to all trainees who work with me and also to any of my patients who have email access. To better educate them on the challenges faced in delivering cancer care, I've also given a free paperback copy to all Canadian members of Parliament and all Canadian senators. And through the Life Saving Therapies Network, we will also soon be mailing out copies to all members of the Ontario Provincial Parliament. The next 16 videos in this channel will deal with different topics I have discussed in the book. And I plan to release those videos at the rate of 1 or 2 per week over the next several weeks. After that, I will go into further detail in some additional topics on both cancer care and healthcare. One thing that I stress in those videos is that individual people should consult their own healthcare providers for any guidance related to their own personal healthcare. Everybody's a bit different and there are different nuances. So some of the things I talk about in generalities in these videos may not apply to individual patients. In addition, by law, I am not permitted to give any direct medical advice to anyone who is not my personal patient. In addition, it is important to understand that different people may draw different conclusions from the available data. So the scientific data we've got, it's like pieces of a jigsaw puzzle with a few of them in place and trying to draw conclusions from those few that are in place, recognizing that many pieces are still missing and that our conclusions may change as those pieces are filled in. So the views that I present are my own personal views, how I am interpreting the data, and they're not necessarily the views of the University of Ottawa or the Ottawa Hospital. In addition, I have many colleagues that will interpret the data differently. I respect their views, they respect mine, but we just differ in how we interpret the available data. But as we do more research, as the pieces of the jigsaw puzzle are filled in, then we'll get a better, clearer picture of what the truth actually is. In addition, in healthcare and medical care, we feel that it is very important that we fully disclose any of our financial potential conflicts of interest. So I receive more than 98% of my income directly or indirectly through patient care, most of it paid by government. But I also receive about 1.3% of my income as honoraria from pharmaceutical companies that pay me for advice that I give them. I give them advice in the hope that they will be able to do a better job in providing medications that help my patients. And they pay me because it can also help them as well. I do not own any direct stock in any drug companies. And also, I try to make sure that my opinions are not swayed by any compensation that I have in the past received or might in the future receive from any pharmaceutical companies. In my book and in my different academic publications, in op-eds I have published in the lay press, and in these videos, I have been critical of both governments because they do not do enough of what I think they need to do to provide access to care, and also to pharmaceutical companies because some of the things that they have done that make things more difficult. The first of the 16 videos that follow will discuss why cancer is so common. Overall, about 49% of all Canadian males, 45% of all Canadian females, 39% of all American males, and 38% of all American females will develop cancer at some point during their life. I discuss why it is so common and also how to reduce risk. So anything that you can do to reduce the rate of mutations in your body will reduce the risk of developing cancer, as at the same time that it will actually reduce the risk of the rate of aging as well. So it'll keep you younger. longer. You should limit exposure to tobacco smoke, alcohol, red meat, processed foods, asbestos, sunbathing, radiation exposure, and other things like that. You should also limit calorie consumption. Try to avoid being obese. Get lots of regular exercise and eat lots of fresh fruits and vegetables. The second of the 16 videos will discuss screening. So things like mammography and pap smears for women, PSA testing for men, screening for colon cancer and lung cancer for both men and women. I will discuss the pros and cons of it and why it is particularly important in people that are at high risk of developing these cancers, and also the high possibility that there will be false positives and why we need to do additional testing and biopsies if we do find a positive, because there is a real possibility that it could be a false positive. So we have to make sure before we take further steps in the management of the patient. The third video will discuss how cancer causes symptoms, things like weight loss and loss of appetite, pain, fatigue, and what we can do about making those symptoms better. The fourth video is about surgery, why it is very important in people in whom it can be done, why it cannot be done in some patients, and why the cancer may come back after surgery despite apparent success in removing all of the cancer that we can see. The fifth video will discuss radiotherapy, how it works, how it can cure some patients with localized cancers, and how it can help control symptoms in people with widespread incurable metastatic cancers, but also why it may fail in some patients. The sixth video is on chemotherapy and why it is so important in the treatment of cancer despite its many side effects. It cannot cure most patients with advanced metastatic cancers, but it can prolong life expectancy, improve symptoms, and improve quality of life in many patients. In addition, for people that are potentially curable by surgery or radiotherapy, adding chemotherapy as well may improve the chance of cure with those other modalities. The seventh video is on targeted therapies, which is also called precision medicine or personalized medicine, how these work and how they have become very, very important over the past few years. The eighth video will discuss the impact of the immune system on cancer and advances in immunotherapy, the huge advances that occurred with the emergence of the immune checkpoint inhibitors, and also the new immune approaches that will come in the future, including cancer vaccines, CAR T cells, antibody drug conjugates, monoclonal antibodies, and other things like that. The ninth video discusses alternative and complementary therapies. I discuss there why they are not part of standard treatment and how one should approach what one hears about these medications. The 10th video is on how systemic therapies in particular cause toxicity in patients and what we can do to limit those toxicities and some of the progress that we've made in reducing the toxicity caused by these therapies. The 11th video is on oncology myths and legends, things that some people believe that are not necessarily true, and how these can impact what we do, but also why we need to be aware of these. And so it'll be things like the belief that eating too much sugar will increase the rate of growth of cancer, or that operating a patient with cancer and exposing that cancer to air will increase the rate of cancer growth. But also the belief among many people that the blood-brain barrier restricts the efficacy of systemic therapies in the treatment of brain metastases. The 12th video will discuss the impact of things that delay clinical research, delay progress. They both delay access to effective new drugs and translate into thousands of years of life lost because of that, as well as they play a direct role in driving up the cost of developing new drugs, and that in turn plays a very direct role in driving up the very rapidly escalating, very, very high prices that we have to pay for effective new therapies. The 13th video will actually discuss a few of the things that are key to delaying access to effective new drugs, that slow down clinical research and drive up its costs. And I will also discuss how the experience with COVID vaccines and AIDS treatments tell us that it does not need to be this way. We can make much faster progress at a much lower price if we just decide that this is important. The 14th video discusses things that are driving up drug prices much faster than inflation, and why it is very, very important to address this and what we can do to address this. The 15th video compares the Canadian and American healthcare systems. As I discussed earlier, I've worked for a number of years in both systems. Both have strengths and both have weaknesses. As I say in both the book and that video, I love them both and I hate them both. They both need to change. The last of the 16 videos discusses the future of cancer care. I talk about Dr. Emil J. Freireich, the head of our department when I started my oncology training, who taught us that the only people who come close to predicting the future are the science fiction writers, and they generally underpredict rather than overpredicting. If we can imagine it, then it is possible that we can do it. Provided we keep on doing the research, we will keep on making progress. The number one risk to progress is the rapidly escalating cost of new drug development and the rapidly escalating cost of the prices of drugs. We need to tackle this. After that series of 16 videos, I will then produce some additional videos that I will plan to try to release at the rate of about one per month. These will deal with other things, just things like how the interpretation of clinical research data is problematic and how we have to do a better job of interpreting those clinical research data. How the Canadian governments, how the problems that we have with them in public funding of effective new drugs. How smoking, how it's important to give up smoking even if you already have advanced cancer, and why how smoking makes people addicted to it, plus many, many other things that I will plan to discuss in the subsequent series of videos. Overall, I hope that you find this series of videos helpful and informative. Thank you.